So our next panel is on engaging students, and I'd like to introduce the moderator, Audrey Ceschia, who is the editor-in-chief of the Lancet Public Health.
Thank you. Yes, and I'm delighted to be here. So, of course, many thanks to Sandro for inviting all of us here, and I'm sure we're going to learn a lot about engaging students on this panel. So we're going to start with Daniel Gerber, who is the Associate Dean of Academic Affairs at the School of Public Health and Health Science at UMass Amherst, and you're going to talk about service learning.
Okay.
7 minutes.
Got it. I'm not going to say anything that hasn't already been said. But I will say I come from a little bit different angle. I have an undergraduate program that's exploding on me. I'm hiring adjuncts left and right. Practitioners, they're wonderful people. And many of them are former students. And they'll come to me and they'll say, I want to teach like you, Dan. And so I'm like, go, Center for Teaching our school, all that stuff, practice. We, go take a seminar on that. And they go, Dan, I'm an adjunct. I'm like, I can't, down and dirty. What can I do? So I actually talked about it. How do you do it simply? Because how do you develop the class simply? Not just service learning, but in discussion. So, okay, so basics are, oh yeah. And I also have a lot of other faculty, young and old, that still say, it's just volunteering, right? Dan, service learning. Or, I came to college to learn, which they usually mean book learning. And we've got to change their attitude, which we do. So basically, a service learning component to a class is to bring life to whatever we're talking about. It's to get the student out into the real world and actually discuss and actually experience what we're talking about in the classroom. The secondary one is basically for them to understand the communities they're going into. Many of our students are going into very different types of communities that they come from, and the prep for that is very, very important. Next one. Okay, so the objective, again, is to bring the life to the classroom, but then also there's a partnership. It's called engagement. It took me 20 years. I was head of the outreach council for 20 years, my whole university. It took me 20 years to get the word outreach out and the word engagement in. And engagement means a two-way street. It's not just us going out there and doing something for them, but it's a two-way street. We do something for them, they do something for us. It's a two-way, it's a win-win partnership. That's probably the key to service learning. The partnership organization has to benefit from it. It's time-consuming to work with our students. Yes, our students are an asset. Yes, they'll do more work, but it's also time-consuming for a good person to actually bring our students up to speed. So it has to be a win-win for both sides. But then they'll say, my adjuncts will say to me, I don't have time to go to the Center for Teaching. I said, fine, here's the experiential learning cycle. This is the key to me. Everything you ever watch me do in a classroom, I don't care what I'm doing, I am using this cycle at some level. It's very simple. I give the student experience. The experience might be I introduce the service learning component in class. That's all I'm doing. That's an experience. I introduce it. The key to David Cobb's service learning is the reflection part. What does this mean to you? Basically, we're training future public health professionals and liberal arts students that we're trying to get them to understand what's their role in it. And this is the key to the whole service learning component, is that they have to figure out who they are in the process. So experiential learning cycles, 4 simple cycles. It's experience, it's reflection. It could be journaling during the actual weekly going out into the service. And then it's also thinking, the conceptualization. That's when the book learning does come really important. Basically, I have to give readings on the theory, on the health problem we're dealing with, the community that we're dealing with, possible solutions, and go back again to reflection. It's a little more, I explained to my adjunct, it's a little more slippery than a complete cycle. Many times you're always going back to them saying, what does this mean to you? How do you feel about it? What are you going to do when you get out there in the real world? Which is the last one, applying. I've been doing this for 40 years. My mentor taught me in Indonesia 30 years ago when I was already doing this, but now she taught me there was actually a framework for it. And my mentor was a disciple of David Cobb, and she came to us and said, adults learn 20% of what they see, 40% of what they see and hear, and 80% of what they discover for themselves. And I truly believe that. I'll go one step farther in the service learning. service learning is 80% to learn for themselves and actually remember. I will meet my students years later, and I will say, tell me something, Dr. Gerber, I took a class, you don't remember me. I used to teach 500 student classes. But we still had them go out and do service and write about it. It's not, I call it 101 service learning at that time, but it was definitely to get them out there. And every agency I'm from the University of Massachusetts, in the Valley, knew about my class. And the students went out and did events. It worked, and they all went out, and the reflection papers always came back. I really didn't want to do that, but I'm really glad I did. I had a phenomenal day, and then my lecture is all about how doing for others is healthy for you, and I make them reflect on that. It's back to that conceptualization. Why am I making you do this? Dr. James Zuhl, the neurologist, he wrote several articles. He finally came out in a book in 2015 on how our neurons change in our brain. I don't understand it. I don't get it. I've read it 15 times. But he's saying through experiential learning, the synapses actually change in our brain so we learn better, according to his research. Back to this, there's a simple way of doing it, the experiential learning cycle. Go. But basically, the project itself, engagement. It has to be a two-way street. It has to be for the agencies, worthwhile for the agency. It has to be worthwhile for the students. The biggest problem, it really does take time to set it up well. It's a time sink, and I would honestly say start simple with the practitioners. My adjuncts are actually easy. Many times they use their own agency, but the on-campus faculty, the biggest fear is how much time will this take? And I can't be honest with it, it's a time sink. Getting the project, preparing what the project would be. Again, it has to be worthwhile for the agency and for the students. You have time management. Agencies run 360 a year. We work on a semester basis. It's amazing how many projects don't start on time. Why can't we start the first week? Well, because they're not ready for you. And the other thing is periodic check-ins. You really do have to stay, even if it's just a phone call or an email, how things are going on. Again, I keep it simple because I want my faculty, and my adjuncts want to do it. I want all faculty to go out and try this. So I keep it simple, but I do put these things. You have to keep going. The other thing, some of you have mentioned this, was we do team building in class because what we're talking about are real health problems. Many times the conversation gets personal. People talk about their personal lives, things that have happened to them. So we do a lot of team building in the class. Basically, you got to build a safe environment. Some of my colleagues before said talk about building a safe environment. It's really, really important. It is quantity over quality. It's no two ways about it. I don't cover the quantity of work, but what I do cover, they remember 5 years later. We bring in guest speakers, and I think, we go from this to this. Oh, and the biggest thing is, and everyone who talked about it before, was you have to give up control to get it back. That is probably the number one on-campus faculty that come to me and say, Dan, you've got a good reputation for teaching. How do you do it? And I'll explain it, because I can't do that. Why? Because, well, for one, they have to listen to me, and I have too much I have to say. And for the other, I can't. What happens if the chaos happens? What happens if it gets messy? And it's 100% true. It does get messy. But as my mentor says, you give the control up to get it back. Thank you.
Thank you so much. So we'll have questions afterwards. And now we are joined by Laura Linnan. You're the Senior Associate Dean of Academics and Student Affairs at the Gillings School of Global Public Health at UNC Chapel Hill. And we're going to go through a group project.
Yes, thank you so much. Good morning, everyone. Really a pleasure to be here, and very excited for the folks that brought us all together, because I think it is a really wonderful opportunity for us to learn from each other. So I'm here today to talk about a group-based service learning approach. I want to give you the context for that. We're in the context of master's and MPH program, and we have a long tradition at Gillings of doing community-engaged work and in community-engaged scholarship back in the 1940s. I wasn't around then, but I've heard earlier today that it's actually about how we evolve our programs. And all of us are in the midst of evolving in different ways now. And I think what's exciting about what I'll share with you today is how our capstone project has evolved over a course of many decades of work, wonderful colleagues that have come before us, but we've moved from like taking groups of students and putting them out in the community to do assessments and then keep assessing and assessing to actually going forward now and being a fully engaged process with our community partners. So I was really heartened to hear that others are using different kinds of conceptual models for thinking about this approach, and we have this logic model that we use for our capstone project. And if you start on the most right-hand side here, what I'll call your attention to is our goal is to have improved public health practice. And the outcomes are to obviously increase the capacity of our students and really important, our partner organizations to actually address public health problems. And the creation of new and or improved public health programs, services, and resources, those are sort of the deliverables I'll be talking about in a moment, and enhance student marketability. And that's been a wonderful feature of what we're doing in the field right now in terms of their job opportunities. And the other sort of side benefit we don't talk a lot about is the strengthening of our campus and community partnerships. So those partnerships that we rely on for student placements and all kinds of things are actually have really been enhanced, both from a practice-based opportunity as well as our research opportunities. So on the left side here, the outputs, I'll talk about more about those in a moment, but these are the inputs, the students' knowledge, what they bring, what the community partners bring, as well as the mentoring and technical assistance that we provide as a teaching team, and a whole host of activities that we engage with our students in order to make this capstone experience as positive as we hope it will be. The thing that I'd like to stress about this opportunity, this capstone opportunity, is that we're trying to find the right balance between the benefits to our students and the benefits to our community partners. We take that very seriously, and the way we go about doing that is actually to have plenty of opportunity for reflection. And we've heard from previous panelists how important it is for the students at every stage of the process to be really reflecting on what they're learning and having a chance to talk to each other and talk to the teaching team and process that. We also have very intentional processes. You saw the logic model, but we also have a whole set of steps that we follow, I'll share in a second, that really take students through this process, but also weave the opportunities to engage with our community partner at every step in the process. And then it's really building on this strong foundation for authentic partnerships. There have been partnerships in the past where, we all know of researchers and practice-based folks who go in when they have the funding and then leave. This is really not about that at all. We have a whole host of community partners that we have been working with for years, and we're continuing to grow that group of community partners. So the capstone project selection, it's a 2-year MPH program. The year before, let's just say they all do the capstone in the second year, but the year before that is when all the work, we're soliciting community partners. We're actually talking and selecting which kinds of projects. We have a proposal. They actually complete a proposal saying, this is the kind of work I'd like to work with your students on. We have training sessions for our community partners to find out what kinds of projects they would like to be involved with our students. We actually vet those. We work with them on the front end to make sure that the projects are appropriate for our particular students in health behavior. This is in the health behavior department. So not every project will work for our students. Maybe we suggest they go and talk with health policy management or some of the other departments in our school. But in blue here, you see what the teaching team does. And we're about selecting and working with the partners. And then we're reviewing these proposals, deciding which are good matches for our students. And then we invite them to what we call pitch day that happens in the spring. Pitch day, they come in and pitch an idea to the students. So they have about 5 minutes, just like we're doing here, to pitch the idea, and then there's time for the students to circulate with all the different community partners and find out which ones they're interested in. Then they rank order. Afterwards, they rank order which ones they're most interested in, and then we actually go about matching the students in teams to their projects, to their community partner. And then we have, I like to call it match day for public health, but we have match day where we actually make the announcement, and we celebrate this because the community partners are really excited when they actually find out they were awarded a team. Not all get a team, and then we encourage them to either offer practicum or actually come back in a future year and invite students to participate. So there is that matching process. A couple of the key capstone components I want to share. There's a memorandum of understanding that goes right up front that the community partners and the students and the teaching team all sign. It's a very fundamental, it's how we're going to operate together, all of our communications and so on. There's a work plan, and the work plan is probably the most critical item because we have key deliverables and the specific timelines for actually delivering those. And the activities could be any number of these sort of core component tasks that we review the proposals on up front to make sure that this is the right work for our students. There's opportunities for presentations. We have an extensive evaluation that's not just course event. We have a 360 evaluation that the community partner gets the feedback, the teaching team gets the the faculty preceptors get the feedback, so everybody's getting feedback. And then we have very supportive coursework in the second year. While they're doing the actual year-long capstone, they have supportive coursework that goes with that. So just a couple examples of capstone teams. One here worked with the Orange County Department on Aging to do a massive plan. That plan actually led to a state award and a national award for this particular group. There's a team that efforts paid off in the passage of a new policy that was actually our bill that was passed in our legislature. There was a group that actually worked on delivering fitness breaks to the housekeeping staff, low-wage workers at our university, and then wrote a grant to sustain that program over time. And here's one student that was just sharing her belief that what she did in the capstone actually led, in fact, to her job. And so just to summarize, in the past 9 years, we've had over 350 students, 82 teams, and almost 50 partner organizations. And we actually asked them to estimate the value of the work that our students have been doing. It's up to $2 million over the last 9 years of in-kind services that our students have produced. So that's a real value added to our partners. There's a lot of resources, you've heard from others, that it takes to actually manage this, but we feel we can't do the training in the kind of training that we want to do for our students without this kind of experience. So thank you very much, and I want to acknowledge my co-authors on the chapter that we worked on for the book here as other collaborators, and then all of our community partners who work on this with us. So thank you.
Thank you very much. And so now we are going to hear about team-based learning. So LuAnn White, you're a Senior Associate Dean for Academics at the School of Public Health and Tropical Medicine at Tulane University. Thank you.
Good morning. The topic I'm going to talk about is collaborative learning using various types of teams. I want to point out my co-author, Angela Breckinridge. Angela has come to Tulane as our curriculum assessment specialist, and it is because of her knowledge of the theory and the pedagogy that has allowed us to really move forward. And in this changing world, I really want to say what a marvelous resource this is. I was trained in toxicology, and I looked at how people taught me, which was standing up and talking, and Angela has introduced to us a whole new world that I think will benefit our entire faculty. So that is a critical element. So in our collaborative learning, what we're looking at is a method where students not only learn the content, but we raise it to a higher level. We're looking to develop problem-solving skills. The collaboration itself is a peer learning process, as well as learning to collaborate and to develop interpersonal skills. The design characteristics take into account interactivity. As some of our other colleagues have said, it's not just sitting there listening, but it's actively participating. It's planned. Again, what colleagues say is it's not something that's done on the fly. There's a lot of planning that goes in, and the more complex the interaction is, the more planning that is required. It's also really important to have established ground rules that the students participate in. If they don't have the ground rules, this is where things where there's problems. And grading is how you have rubrics, how it's transparent, and how students perceive that it's fair. And as we go through this, we'll see that if we don't have this, we have challenges, both from the terms of negative attitudes from students and also from the faculty of not really understanding what they need to do when we say, let's do some groups or team-based learning. we found that student resistance is a factor. Most of it is because they've done this before with very bad experiences. And as we probe into there, we see some of the reasons for bad experiences is not using design methods, lack of structure, just saying, oh, well, you all get together and talk about it. That doesn't work very well. Inadequate preparation, randomly formed groups, a whole list of factors that if you really do design it, it's well. Students who've been in classes with well-designed group learning and team-based learning, they really appreciate it, but that doesn't happen. And so we see it's incumbent upon us to train our faculty, to show our faculty new methods, because like me, you never got that in school. So planning is a big piece of it. There's types of different team-based learning and collaborative learning, and these increase in complexity, and they'll also need more time in preparation. So in-class activities, formal group assignments within a class, team-based learning where the whole semester is done in teams, and then interprofessional where we're bringing in other professionals and learning. So in the design, what is the purpose of the activity? It's not just something that's extraneous. There's a real purpose to achieve learning objectives. There's real care into forming groups. What is their competition, the composition? What is the number of students? Group dynamics. This is where our ground rules come in. And not only what are the ground rules, but role playing, particularly to highlight negative behaviors. Students who take over, the free loafers, the aggressive student who doesn't want to depend on their grade from anybody else. They want to do it all. So this can be brought in at the very beginning. So taking time, taking a whole class period, even to go through this role playing. Then when a case arises, the students can go back and go, oh, you were this stereotype, and it really helps to diffuse some of the issues. And then grading. Students go nuts when they think their grade is dependent on everybody else. So to have a real rubric where there's an individual component and there's a group component, but the group component includes how well do you collaborate. So it depends on them, but it also depends on them actively working in the group, contributing, and that collaboration is actually part of their peer learning that makes it stick. You can't read all of this, but what this does is that it compares these different types, and it shows that they increase in the time that it takes and in the complexity. You can use small groups in-class activities to have 2 or 3, if you're discussing points, to get together for 5 or 10 minutes. Doesn't take much structure. But as you move to formal group assignments, the instructor needs to take an active role in assigning groups, not just saying get with your friends, so that there can be a cross-section of different people, different levels of learning. And then moving on, if you have a whole course that is team-based learning, the structure of the group is very important. It's more complex. It takes a lot more time to develop and plan, but you get a lot more out of it. And then moving to interprofessional practice, again, this takes more time. It may last more than a semester, bringing in multiple types of stakeholders into their great learning, but it takes a lot more planning and following the various guidelines and framework for each one of these types, so that you are picking and you're selecting the type of team-based learning, type of collaborative learning that fits with your goal, that fits into your class, and that is actually designed into it. So just some recommendations. Plan the collaborative study well. Align it with the course objectives so that it's not just an extra appendage that's stuck in, but it's actually a part of learning. That means giving up lecturing. Our faculty don't want to give up lecturing. They want to tell you absolutely everything. Well, students can discover some of that on their own if you guide them. To emphasize that collaboration is part of the outcome. They don't think about that. Neither the faculty nor the student think about the collaborative part is actually giving them skills, giving them higher level skills. The ground rules are essential. the grading where you look at both the individual and the group, and that it's transparent and that students perceive it as fair. As soon as they think it's not fair, that's when they go nuts. And then go back and look at the evidence-based research. There's a lot of very good information on this area for how to frame them, the design methods, how to put it in, and how to actually make it work for you. So thank you.
Thank you so much. So now we're going to hear Kathryn Cardarelli, your Assistant Provost for the Faculty Advancement at the University of Kentucky, and you're going to present and talk about maximizing student engagement.
Yes. Thank you, and thank you, Sandro and Lisa, for the invitation to collaborate. It's great to be in a room full of friends to talk about something that you're passionate about. So I want to start by acknowledging my two co-authors. Angie Carmen is our Associate Dean for Practice in our College of Public Health, and Trey Knatzer works with our university's Center for the Enhancement of Learning and Teaching, and I have learned a lot from that on-campus resource. So I've been at UK for about 5 years now, and I have learned that the #1 way to engage students is to put on a basketball game. And I'm not going to say much more because our team didn't do so hot in the tournament this year. But you know, we've heard a lot today. I'm not going to read these line by line about the importance of student engagement. We know that it's a predictor of retention and success. You've heard a lot about different tactics of active and collaborative learning techniques that can really enhance understanding. I would argue, though, that this is particularly true in public health education, where we are striving to produce workforce-ready graduates to engage with communities as soon as they're finished. So in our chapter, we go into great detail about different tactics that you can use to engage students, such as think, pair, share, and affinity mapping, problem-based learning, and team-based learning. But when I thought about what I could share in 7 minutes, I decided I'm not going to go into this. I'm going to give you a couple of examples of other tactics that you might use to engage students in the classroom. And the first one is what I would call inclusive teaching practices. And there's a full body of literature out there on these practices. The course that I'm teaching this semester is a graduate course on eliminating health inequities. And we talk about really difficult issues. We start with what is white privilege and what is structural racism and how does that manifest itself. A lot of folks in other disciplines may not go there, but that's who we are in public health. Those are the topics that we have to engage our students in. So the example that I wanted to bring to you is actually one that LuAnn, I think, touched on a little bit, and that is at the beginning of the semester, ask your students to collectively decide on what they would use as ground rules to engage in discussions through the semester. So I start by telling them we're going to have difficult conversations in this class, and you're going to feel uncomfortable, and that's okay. This class is about growing and stretching in your understanding of the world that we live in. And so I have them literally put together what we call communal agreements about how we're going to facilitate difficult discussions. And these are just some of the examples of the actual communal agreements that my students this semester came up with. Be open-minded, freely share perspectives without burden, and respect others. So we codify this. We put it on our Canvas site. We actually bring it up sometimes when I know that we're covering a topic that may make students feel uncomfortable. This has worked very well for us. And then the other example that I wanted to bring to you is another example of experiential learning in public health. So as we've heard today, this can include tours, observations, environmental scans, and the specific example that I'm going to share with you today is one that we did in a social epidemiology class that I taught a couple of years ago. I was working on a project at the time where we were looking at really high infant mortality rates in a particular city, and we were engaging in community-based participatory research. We had a community advisory board that was guiding all of the steps in the project. So I decided to fold these two together, and we went to the community where there were these really high infant mortality rates. We had a pastor who was local to that community and was the chair of our community advisory board give some context and history for the students so that they could hear firsthand of what it was like to be in this neighborhood. And then I actually charged them with going out into the community in groups to asset map, specifically in this case for preconception health resources that they thought might be relevant. So these are some of the images that my students actually took. You know, they went out and they looked at what were the food options in this particular neighborhood, and there weren't a whole lot. I also sent them into some of those food resources with a list, a grocery list. And I said, you know, tell me how much money would it cost to purchase these items. It was quite eye-opening, and to this day I still have students who've gone on and done their PhD and come back and talk to me about this experience, how impactful this was for them. I had them chronicle what was in the stores, what options were there, what options were not there, what was the quality of the produce, what were the temperatures of the meat, and that sort of thing. And then they came back to the Community Advisory Board who was waiting for them, and they shared their reflections and of that experience with the board, and then the board reflected on their reflections. So this was sort of a co-learning experience that, again, to this day, I still have students who come back to me and remark about it. So this is my March for Science photo. I'm glad to hear and see that a lot of us are on the same page on some of these issues, that the world is changing. And I know in our College of Public Health, a lot of our students are out ahead of us. They're passionate about these issues. And I would argue that we have an obligation to engage students in meaningful ways outside of the classroom so that they are the next voice for social justice, for active citizenship and equity in public health scholarship and practice. And that's it. Thank you.
What a panel. You finished even earlier than we should have. So thanks all for all your presentation, and I would like to open the question to the floor. I'm sure you have many questions since this morning. So please. Yes.
About rubrics, you mentioned that it's very important to have clear evaluations, fair evaluations, but our students are not going to find rubrics when they are working. Therefore, I have always thought that we're making them a disservice by using rubrics, making them believe that the work is fair, that the employees are going to be fair, and a little taste of unfairness and paranoia will make them a favor.
Well, what we find is that the rubrics give us a standardized way of looking, and students appreciate that. When the most common complaint for students in grades, about grades, and particularly in groups, is if they don't feel that it's fair, or they don't feel that they know what they're going to be graded on. Now, it's not necessarily down to the detail of what they do, but it's that they will collaborate on a higher level. You know, as associate dean, I get all the complaints, and probably 75% of them are, I didn't feel I was graded fairly. The professor, on the other hand, says, well, they didn't do the work. And then you bring them together, and the expectations were different. So rubrics are a way to have common expectations, but they shouldn't be so detailed and so inflexible that they feel like they've got to check off items. It's more a general guideline. Do you mind?
I'm just curious, with group-based learning and teams, how do you direct the process? I've tried to make it organic somewhat and let students choose their own teams. I'm working with something now where the weakest students have joined together and the strongest students have joined together. And now, you know, how do you dictate? I would have loved it where a strong student was paired with some weak students, so I'm just curious about it.
Well, I've learned a lot from Angela Breckinridge, who really goes about this from a framework and a theoretical model and has looked up the evidence-based research. So, you know, if it's me, I would go, oh, well, whatever makes the students happy. But that isn't really how they learned well. So if, in my presentation, there was different types of activities. So if it's a small in-class activity, if you have a discussion and you want students to discuss it, they can talk to the students around them. But if you have where there's, a team project, what'll happen is that friends will get together, people in the same disciplines, and what you want to do is have a more broader composition of those groups where you have strong students, weak students, medical students, public health students, social work students, so that you're combining them. And if you let people self-select, all the same ducks go together, and what you want is a variety.
I just want to add that because our capstone is year-long, we're very intentional about the teams. They do get to have their top 5 choices. They get to say which projects they want to work on. They also have the opportunity in some cases to say, are there any individuals in your cohort who you would really prefer not to work on? That's confidential, obviously, but that's information that's taken into account as the teams are actually put together. And then the ground rules, going back to the ground rules comment, I think it's extremely important to have those. The teams actually come up with those. There's a lot of pre-work going into how to work in teams as well, because in the real world, they don't get to go with their friends. They're going into a new workplace they might become friends, but they're not going in. So we really talk about this being a opportunity to learn how the world works in a job. So
and I think it's part of teaching them professionalism. Our biggest comment back from our preceptors are, you have bright students, they're eager students, but they lack professionalism. And so part of it is, in professionalism, you work with everybody on a professional, respectful level. They don't have to be your best friend, but while you're working with them, you have to work in a way that stimulates to the end, not on your individual likes and dislikes. So once students get into groups, they tend to then form new friendships, as was done. So letting them expand, but then directing them. I've got a case now where a faculty said self-select, and we happen to have undergraduates. All the undergraduates got together, and now they're really having problems. So it would have been better had these groups been determined by the instructor.
So maybe you introduce yourself before the question. So
Sure.
Amy, do you want?
Yes.
And then we
Am I
have
on?
one
Yeah.
ear and one ear.
I'm Amy Fairchild. I was at Columbia University for a long time, and now I'm at Texas A&M. And one of the things I think we always, so you put up your evidence-based slide, science slide, and I think that one of the things we always do with faculty is show them the data, that this works better. But and I have found faculty particularly resistant to the data, which is funny for an evidence-based field. So in some ways, we're, we in this room, we're not just the choir. We're at the soprano section, and then we're the ones who show up for the early service. When I was having a conversation with Nancy Kane and Donna Peterson and Wendy Mariner after the first session, and one of the things that has struck me over the years, and I've never done it, but now I'm resolved to go do it this time, is that the students who are the very best and engaging and active learning are the ones who have what I take to be the skills of improv. They listen, they're quick to make connections, they're able to dwell on the ideas of others, they're flexible, they're able to shift and riff off of each other. And the discussion we were having is maybe it's not only students that need to be trained in these methods, but faculty members themselves. But I mean, like something real, like, I would love to see us, try a collective experiment, and let's bring in an improv instructor and see if if the data's not going to do the trick, maybe kind of a physical active learning experience would do it.
All right, very good comment. Do you want to add anything, or we can move to the next question? So,
my name is Steve Jones, and I applaud your structural racism in Kentucky. I wondered how that played out in the educational institution you're in.
Yes, so thanks for noting I'm in Kentucky. I don't know among our graduate students that we're necessarily all that different from other schools of public health. We have a very diverse student body, but undergraduate students is a little bit different. Now, the course I'm teaching this semester is a graduate level course, and I will just say in response to Amy, your question, that sometimes we have to take risks as faculty members, and it's scary. And I did that 2 years ago with the change of presidential administration. I thought I need to change the way this course is taught. And I need to go directly at some of these issues right off the bat. And so I turned to our Center for the Enhancement of Learning and Teaching on campus, and they literally held my hand through the changing, of the course. And they gave me these tactics. And I literally called them before I walked in the first day of class and said, "Here I go, say a prayer for me." But it's worked out well. And the students are out there, the graduate students. They're ahead of us, I think, on a lot of these issues. Look at the march. Look what we saw. Undergraduate students is a little bit different. Kentucky is a predominantly rural red state with two little blips, Lexington and Louisville. And, our president of the university called the academic leadership group together after the election and had a conversation with us, closed the door, and said, these are interesting times, and we have to be mindful of who our students are. Undergraduate students that are coming to us, they've had philosophies and views of the world that are going to be very different than what the faculty have. And so, it's an ongoing challenge. But again, it's what we do in public health. We have these difficult discussions. We don't beat around the bush. So it's been a good experience, especially with the graduate students.
Thank you. There was one more? No. Oh, yeah, many more. Go ahead. Sure, if you want.
I wanted, and maybe more or others, I wanted to sort of unpack the reflection piece, because I think we get a lot of pushback from students who say, I was asking about the reflection piece. I think we get a lot of rolling eyes and pushback a little bit, like, how do we make the reflection piece a structured and meaningful component? I think it's integral to getting the engagement and the active discussion, but I think we haven't really unpacked what do those look like and how do we do that well so that we can advance their learning. So,
yeah, I've seen this process evolve over 9 years, so it's actually, we've learned a lot. We had big questionnaires and all kinds of ways. What it has come to now is that our teaching team sends out Qualtrics surveys both to the faculty preceptor, to the capstone team itself, to the community partner, and to the teaching team. So there's one full-time instructor and 1.5 TAs assigned to the capstone of about 50 students. And so they each get but it's very short. It's like, how can we improve? What's not working from your perspective? How can we move forward? Are there things that you want to see more of, less of? That kind of thing. Very short. And where the real advantage is that people get them and then have conversations about them. So the reflection on the reflections is what is really valuable. And I know I just got my faculty report card, if you will, because I have a capstone team this semester. And, they're thoughtful, and they make you think, and they make you say, wow, yeah, I guess that could have been, something that might have been misunderstood in what I was trying to, think about. So anyway, I think it's all about the reflections of this very short questionnaire process that we're using, and that's been really, really helpful. And the coursework, they have a lot of good discussions about what's working and what's not, and that's an added layer to it.
I agree. I get a lot of pushback in the beginning about the reflection piece. What's the worth of that? I'll do a reflection piece, and basically grading is a big part of it. So clarity. There's no judgment in the reflection piece. It's all on clarity of thought. And then we'll actually go back at the beginning of the end of the semester and go back and look at some of the ones and find out how they've changed. That's usually when I win them over.
Oh, can I add one thing? I'm sorry. The timing of the questionnaires, we do mid-course and final for both semesters. So they get you hope to see improvement. It's about a quality improvement process over the course of the year. So I just want to add that.
We have time just for one more question. Even not. So maybe, Sandro, you mentioned there was many people coming from university, from Europe, from Moscow, from Israel. So I was just wondering if maybe in 1 minute, someone from another country could, maybe reflect a couple of points on engaging students? Did they find it maybe easier? I believe maybe not. Clearly personally as a foreigner, I was impressed by what happened. It was on Sunday, I believe, this march from those students. I believe few of them were public health students, clearly engaged. They didn't need that panel to get engaged on such an important public health question in the US. So I haven't seen that in other European countries, so I just thought maybe someone has another view, but happy to move on otherwise. Our friend. Very short.
Hi, I'm Limor. I come from Israel, Ben Gurion University of the Negev. A lot of the things I'm hearing here are very similar to what we have in Israel. I teach the capstone project for the master's degree, and probably everything that has been said here, including the engagement with organizations, everything is very similar. For us, maybe one difference is that our students are a bit older than the typical undergraduate American student, and probably also older than the graduate American student. Meaning that some of our students will be mid-career people coming just for this project, and then they themselves will be bringing their environment into the classroom.
Thank you very much. So I think you want to add a view from Berlin, very, very, very rapidly. We've been amazing this far.
Yes, Tobias Kurt from Berlin. I have teaching experience in the US, France, and Germany, and clearly it's totally different where you come from and where you teach, actually. So the cultural differences, I think, has to be taken into account. There is not one fits all model, obviously, and you have to work, obviously, to motivate and activate students. I completely agree with, but the way how you do it is very different in the country. So in France, wouldn't work. In Germany, wouldn't work. In the US, works perfectly. So the question is, how do you get these ideas and really implement them, which are clearly very important. So
and I think you're making a perfect link to the next panel about diversity and inclusion.